So doctors don't particularly know very much about hair loss. They are very good at those acute problems, so if you've got a heart attack, fantastic. If you've got blood pressure problems, wonderful. But hair loss lives in that area where you don't have to be ill to get hair loss. You can just be not well.
What are the leading causes of hair loss?
For men, it is genetic hair loss. 50% of men at the age of 50 will suffer from 50% hair loss. It's quite a nice way of remembering that, and that is purely to do with your own genetics. For females, far more complex. Telogen effluvium, which is general hair shedding, that can be due to nutritional, metabolic or hormonal problems. And that in turn, if there's a hormonal problem, that might cause a hormonal or genetic form of thinning for those females. So you've got two problems which are very, very common, which may roll into one with females quite a lot. And from there is also, of course, the autoimmune body of hair loss, so that is alopecias. And those are then formed into non-scarring and scarring alopecias. So you get the alopecia areatas and the alopecia totalis, but then you also get the more severe versions, which are things like frontal fibrosis and alopecia and lichen planus. So there's lots of different reasons. One of the things that people really get mistaken is hair loss just isn't a thing. So when you go and buy a bottle of hair loss tonic, the problem is, what's your hair loss? What is the problem which is causing it? And what is that product trying to do to your hair? Sure. So you need a diagnosis about it more than anything else.
So should I be worried about hair loss?
Again, a very good question. Hair loss is an issue which is 90% emotional and psychological and 10% physical. And the reason why is because you can lose every single hair on your head, and if you don't care about it, then there's no problem. But if you do care about it, then it can become a problem. And then there's a spectrum, because the people that can lose very little hair can be extremely upset about it, and then the people that lose a lot may not be, or vice versa. So when should you be concerned about it is when you're concerned about it.
Can hair grow back after thinning?
Yes, hair can grow back. The thinning part of it is you have to be careful of what is the thinning. So acute telogen effluvium, that's from a shock, so that's from a car accident or after childbirth. You don't even have to do anything. The body just self-corrects itself. When people have been thinning for a long period of time, then you can get some of the hair back, but usually you don't revert back to what you used to have. Can I get my hair thick after it starts to thin? We know now that hair doesn't unminiaturize. So we know that if there is a hormonal problem or genetic problem, hair tends to sort of get thinner over time. We can't make that hair grow back thicker anymore. But hairs grow in groups. So hairs should grow in 2s, 3s and 4s. And usually what you find is that those thinner hairs are in singulars. So you get one single hair in a follicle like that. And what you can do is get those multiples to grow again. So your hair does get thicker, but not because of your hair growing like that again. I think that when a balding man buys a laser device, it grows hair better. It will grow your hair back.
What do you think about combination therapy then for people that are suffering with hair loss? And do you think low-level laser can play a part in that?
Certainly, and it is a great, like I said, it's probably my favourite adjunct therapy. So when people are on first-line therapies, which are usually medical therapies, especially for genetic hair loss, like minoxidil or finasteride, those are your go-to backbone treatments. And when they turn around and go, it's doing something, but I just need the extra bit of boost, then that's when you add in the laser therapy, because number one, there is no contraindications. It's not adding another medication or any types of chemicals into the body. It's safe, it's effective, and it really, really helps as a booster.
What are some of the benefits of low-level laser therapy?
The benefits of low-level light therapy is that there is no side effects, that it is non-invasive, it's not painful, so it's a very safe treatment. If you've ever gone on holiday and you felt your nails grow longer or your hair grow thicker or longer, that's the same theory. It's light, That's all you're doing. You stimulate nail beds and hair follicles, and it increases the energy output of those cells. And that is simply what low-level light therapy does. So we know that it works.
Based on your expertise and experience, why would you personally recommend Hair Max to a patient who is experiencing hair loss?
I usually tell them to look at the Hair Max range because there is a wide range of products for everybody. It fits every pocket. The whole point of a laser diode is that the light is very direct, but as soon as it hits something, that light refracts and diffuses. Those teeth move your hair out of the way, so this shines onto your scalp. That's the benefit. What people are buying is ease of use.
And what convinces you to continue endorsing low-level laser therapy as a treatment?
Low-level light therapy helps, certainly, and it is an easy, applicable, safe treatment.